What is heavy implantation bleeding and how does it differ from a regular period?
Hello, and welcome to this informative video. Today, we are going to discuss an important topic that often causes confusion, especially among women in their reproductive years. Our focus today will be on heavy implantation bleeding, what it is, and how it differs from a regular period. This information is essential for anyone trying to conceive or seeking to understand more about their menstrual cycle.
What is implantation bleeding?
Implantation bleeding is a phenomenon that may occur in early pregnancy. It happens when a fertilized egg attaches itself to the wall of the uterus, leading to slight bleeding or spotting. This is known as implantation bleeding. It typically occurs 10 to 14 days after conception, around the same time when the next menstrual period is due, which often leads to confusion. However, it's important to note that not every woman will experience implantation bleeding.
What does heavy implantation bleeding look like?
There's a bit of a misnomer in the term, heavy implantation bleeding. Implantation bleeding is usually light, often just spotting. If you're experiencing what you believe to be implantation bleeding but it's heavy, similar to or more than your regular period, it's essential to seek medical advice. Heavy bleeding could indicate a variety of other health concerns, including ectopic pregnancies, miscarriages, or other non-pregnancy related issues.
How does implantation bleeding differ from a regular period?
Several key differences can help differentiate implantation bleeding from a regular period. 1. Timing. Implantation bleeding generally occurs about a week before your expected period, while menstrual bleeding happens around 28 days from the start of your last cycle. 2. Color. The blood from implantation bleeding is typically lighter in color, ranging from light pink to dark brown. Menstrual blood, on the other hand, is usually bright to dark red. 3. Flow. Implantation bleeding is usually lighter and lasts a shorter time, a few hours to a few days. In contrast, a menstrual period typically lasts between 3 to 7 days and has a heavier flow. 4. Associated symptoms. Implantation bleeding may be accompanied by mild cramping, but it's typically less painful than menstrual cramps. Some women may also experience lightheadedness or nausea around the time of implantation. In summary, implantation bleeding is a relatively common occurrence for women in early pregnancy, but it can often be confused with a regular period. However, the timing, color, flow, and associated symptoms can provide helpful clues. If you're ever uncertain about bleeding or experience heavy bleeding that you suspect might be implantation bleeding, please consult with a healthcare professional. We hope this video has provided some helpful insight into this topic. As always, every individual is unique, so these are general guidelines, not definitive rules. Stay safe and keep learning about your body.